Greetings everyone. I am Dr. Jude Christenson and I am an ENT specialist. I am here today to discuss about feed management for patients suffering from amyotrophic lateral sclerosis. Firstly, we will see about how normally swallowing occurs. So swallowing is a continuous process with three phases. The first will be a oral phase, then will be the pharyngeal phase, and next will be esophageal phase. Oral phase is the process that happens inside the mouth, oral cavity. For solid foods, there is initially a preparatory phase followed by which the food is transited in the transit phase. Preparatory phase is like, for example, the solid food is chewed into small pieces and prepared that it is can be taken to more posteriorly. Next, the food enters into the pharynx, next into the esophagus. In this photo, you can see the sequence of swallowing. First of all, this is the bolus, that is the food that has been taken into the mouth. So it is lying above the tongue. Then it is prepared into a bolus and it is pushed behind the tongue. Third photo, you can see the food has reached into the throat. While the food reaches the throat, this is the airway that you can see here through which breathing occurs. The airway is temporarily closed so that whatever that food that had been swallowed doesn't go into the breathing passage. In the last photo, you can see there is a sphincter here that will get closed and the food will get propelled from here to the downward portion, which is called as the esophagus. Now we are here to see two terms. The first one is dysphagia and the other one is aspiration. So what is dysphagia? Dysphagia is the medical term that is used for any swallowing impairment during any stages of swallowing. It basically means that there is an increased effort that is needed to be put to attempt swallowing, or also if there is any symptom of a blocked sensation while swallowing, this is also called as dysphagia. Dysphagia is a symptom of an underlying ALS. While swallowing, if the airway is not protected, it can lead to aspiration, which is basically an attempted swallowing of solid or liquids will get misdirected into the airway, and it can also lead to lung infection. 85% of people who are suffering from ALS can experience dysphagia at some point of their disease course. In this photo, you can see two photos here. The first one shows how food passes into the lower food pathway. This is the tongue. The blue color thing is the food that gets ingested. So it is going from behind the tongue into the throat into the esophagus. This is a normal swallowing, which is a safe swallow. In the second picture, you can see while an attempt of swallowing is done, a small portion of the food that has been ingested gets misdirected into the airway here. So this is called as unsafe swallowing and it is called aspiration. These are the typical symptoms, swallowing difficulties that patients with ALS can experience. There can be difficulty in managing saliva, there can be difficulty in chewing, there can be spillage of food through the lips, there can be difficulty for controlling the feed inside the mouth, there can be difficulty to push the food to the back of the mouth, and after swallowing there can be a residue still left inside the mouth or in the cheeks. After swallowing, the food can come out through the nose. There can be a sensation of choking or cough during attempts of swallowing. And during swallowing, there can be shortness of breath. There can be regurgitation, which means that food comes back into the throat after an attempt of swallowing, and the swallow and it has once entered into the throat, it comes back into the throat. That is called as regurgitation. Okay, if a patient has any of these symptoms, we can evaluate further with some swallowing assessment tools. The first one is the fiber optic endoscopic evaluation of swallowing, which is also called as FEES. That is shown in this picture. So this is a doctor standing with an endoscope. The endoscope is introduced through the nose like this. This is the nose, it is getting introduced into the nose. From the nose, it will go into the last part of the nose, which is called as nasopharynx, which is in continuous with the throat. So from the nasopharynx, it goes into the throat and then into the till the pharynx, oropharynx, and we can assess swallowing by concomitantly we are giving the patient something to drink like a semi-solid or liquid that is mixed with a dye for enhanced vision. So under vision we can see how swallowing is occurring, which I will demonstrate in a video. So this is a feast getting conducted actively. This is the central portion is the airway through which breathing occurs, and these are the vocal cords on both sides, and this is the region through which food passes from the throat into the esophagus. Now food mixed with the dye is will be given to the patient to swallow, and we can see where the food is getting directed. Now as you can see an attempt of swallowing, with attempt of swallowing the food is getting little bit into the airway also. So this is an unsafe swallow. The next test is video fluoroscopic swallowing study. In this test, we give the patient food that is mixed with a contrast material, and the patient is made to swallow it, and the swallowing is assessed with the help of X-rays. X-rays are taken in a continuous process, so it's a dynamic assessment both in anteroposterior, that is from the front, and from the lateral, that is the side of the patient. So now we will see the strategies how to overcome malnutrition in patients with ALS. So the strategies for swallowing are effortful swallow. That means the patient has to put more effort to push the food through the throat. Next is the chin tuck posture to swallow. Third is we can advise patients to take small bites at a time, chew properly and swallow. The fourth is for each attempt of swallow, double swallow has to be done. That is 2 times it has to be swallowed in the throat. We can also do dietary modifications of the consistency of the food. We can use thickeners. We can use interventions to give food through tubes, which can be either a peg or a rig. And we should ensure adequate hydration for the patients with ALS. These are the things that has to be watched for in patients with ALS. Constipation has to be avoided. Patient has to be hydrated properly. Malnutrition should be avoided. Proper protein intake should be there. And meal time should be reduced. These are the feeding delivery methods for patients who get feeds through tubes. It can be administered as boluses. It can be delivered through gravity or through an enteral pump. Thank you.